So I think traditionally the focus in terms of research in pancreas cancer has been in the metastatic space, but a topic that we haven't touched on is really the one of early detection and trying to identify this disease before it even becomes established, because that's where I think the major gain is in this disease. You know, pancreas cancer is a major public health problem. It's the disease of the future as we all get older, as we adopt Western lifestyles, etc. So rising incidence, and there have been some early hints that maybe there's the beginnings of being able to identify who might be at risk. So for example, in certain families where we know there's a genetic driver of the disease, a BRCA mutation or a Lynch family, they are groups of people that will recommend healthy carriers of those genes in those families to be considered for screening. A lot of early biomarkers being looked at, and I think having the opportunity to serially look at samples in people who've gone on to develop pancreas cancer, but being able to access that many time points before they were diagnosed will provide in certain populations some insights. So there's some large registries looking at this, but that's, I mean, I think again it's a very high bar, but that's certainly an area of major focus. And I'll mention one more, is bringing drugs that have traditionally been developed in later stage disease, bringing them to the group of patients who get resected. We've been slow to do that in pancreas cancer, and arguably the gains might be greatest there, right? These are patients who are going to do best already, and if we have the best of the best added to the current standard, maybe the cure rate or the time to disease recurrence is going to be pushed out.